Good morning. This is the Carlisle Community Forum. It is Wednesday, the 17th of June, and I'd like to introduce the people who are with us today. Chuck Bagnashi, who is our technical person and is moderating from the technology standpoint, and Gina Rada, who is our Carlisle Veterans Agent, Joan Ingersoll, who is our new COA director, and Brian Soros, who's our chief of police, and Elizabeth Acquaviva, who is our Friends of the Carlisle Council on Aging rep. So with no further ado, Joan's gonna join us.
Good morning, everybody. I'm delighted to be here. As Angela mentioned, I've been the director of the COA for a little over a month, and it's been a very interesting yet exciting time to be part of the community. I've been really struck by how much people are helping each other and volunteering and working together to get medication and groceries and Meals on Wheels and other necessities to seniors and people in need in the community, and how hard the people in town are working to try to keep people safe and keep people connected and, you know, do the best that we can through a very unusual and challenging time. We were very excited to learn that the Concord Carlisle Community Chest is providing our grant request for $16,000 for fiscal 2021, which we're going to be using to fund additional social worker hours for the town, and especially for the seniors. So we were very happy about that. You know, Angela and the staff have been working really hard. We're going to talk later in the program about all the both in-person and virtual opportunities we have so people can stay connected and so we can try to mitigate social isolation that people may feel during this time. I do have an announcement that I was asked to make on behalf of the town regarding the election. The town election is on June 30th. It will have shortened poll hours from 11 to 7 p.m. You can visit the town website for information about voting by mail. And if you choose to vote in person, please follow all instructions and safety guidelines communicated by election officials. Please wear a face covering if you are able to and maintain social distancing. And as always, if seniors have questions, want to talk with us, want to connect with us, somebody's in the office or, you know, responding to phone calls every day, Monday through Friday, and we welcome your calls. So that's all I have for my introduction.
Thank you, Joan. So next we're going to ask Chief Soros to give us an update from the fire department.
Yeah, so Chief of Police would be a new role for me. I've been appointed as the fire chief, so maybe that's what we'll...
Sorry. Yes, Brian's the fire chief.
So in any case, I spent 30 years doing IT and doing teleconferencing, and I thought I was getting away from that with this job, and things have changed a lot, haven't they? I think I've been on teleconferences half my days since this all started. So I'll give you a few notes about the COVID-19 pandemic from the fire department's perspective and what we've been up to. So in terms of the medical calls, we actually had a big reduction in the number of calls we usually have. The problem is when we've gotten them, they've been a lot worse than usual. So kind of at this point, if you think you need us, please give us a call. If you think, you know, being seen by a medical professional is needed. You know, if you have abdominal pain, you don't have to wait until that appendix bursts before you before you get seen. So go ahead. I have not heard of anybody getting COVID-19 in the medical environments. It may happen, but in hospitals or ambulances, we're trying to be very careful, and it should be a safe thing. If on the other hand, you know, telemedicine will work for you and you're able to do that, it is a valuable option, and there is no risk, of course, of virus transmission doing that. So just in terms of our region, Massachusetts is in better shape at this point. Our curve is going in the right direction, but the virus is still out there. So if you have options to like avoid grocery stores or things like that, you know, consider using your other options. The rest of the country is not kind of on the same trajectory. There are areas that are not on the same trajectory we're in. I just went out to Indiana. Almost all employees on my drive through Ohio and Indiana wore masks, most of them wearing them around their necks. So, you know, the rest of the country hasn't drunk the same Kool-Aid we have here, and you know, people come from other areas, so try to be careful. It's still out there, and you know, it's a real thing. It's not just the flu. People, even if they recover, can often take months to recover. So, you know, try to stay safe. Our community is trying to do whatever we can to keep you healthy, so you can help us by taking advantage of those services that you're offered. So also, just in terms of the fire department, it's been kind of a challenging time. We work as a team. This is a team sport, but we also want to work safely. So, you know, the team aspect of what we do can't be overstated. That is the way we stay safe. It's the way we work. But of course, teamwork is hard in a physically distant approach. You may have seen us doing these midi parades around for, you know, 4-year-old birthday parties. You know, when we've been doing it, we just have a couple of people in each truck. We have on masks, and the people doing it are completely doing it as volunteers. The department members really feel it's important to support the community through this pandemic, including the children. Doing things as a team, though, like this, also just helps the department. It's important for us to maintain our teamwork. So you'll also, if you're out and about, you'll see us training in small groups at times. What we've moved to for the fire training is Zoom calls, just like this, where we have an hour or so classroom session and Zoom calls, but then the physical part of it, the practical side, we're breaking into small groups and we're still going out. But if you see us, we're being as careful as we can be, but we do need to do the training. We need to progress. We have a large number of new people, and for their safety, they need to be trained. And for the town's protection, we need people who are trained to do their work. So if you have any questions, feel free to contact me now that we have a full-time chief. I'm here most days and happy to answer questions and happy to help out for people who need help.
Brian, for anybody that's seeing this that isn't familiar with Carlisle's fire department, maybe you can tell them a little bit about how you're made up, where so many of our firefighters are volunteers.
Right, so we're a little bit unique in that your people responding to you are your neighbors. Most of us live in this town. If we don't live in this town, we're right on the border. Almost everybody is a town member. The people on the department are everything from lawyers to contractors to IT people, and their full-time jobs. We have pagers. We're called out whenever you call 911. They page us out. We're broken into groups, and they call out the number of people they need for that particular kind of call. We respond from home, come to the station, get in the trucks, and we head out from there. Our response time is actually pretty good, being that most of us, the station is nicely positioned in the center of town, but we are coming from home to get to the station to respond to calls. We are not paying people to sit in the station waiting for calls. That's not the way we work, but it means that you have people here who are doing it because they want to help their neighbors, and it's a real privilege for us to be able to do this.
And how many firefighters do you have compared to EMTs?
So we have close to, well, we had almost 44 or 45 firefighters. We have a number of people whose houses are on the market. We're going to see that drop a little bit. We now have 22 EMTs. So we did a training in town, and we have increased our numbers a lot. Of those, probably 15 are we consider trained enough in terms of how we do things to be going on calls. So one of the things that's nice is if something happens, one of your neighbors may be an EMT, driving by who can help you. So there are more people in our town who are trained to help in a medical emergency than in most towns. We also have 2 ambulances for a town of 5,000. We kept our old ambulance, so we have a lot of resources for a town our size.
And lastly, what would you like the town to do for you? Is there anything in particular that the fire department needs help with?
Oh boy, I think one thing that we do try to, especially for our older residents, is if they can put their house numbers out so that they can be seen coming from both directions, that can be a big help. So you think about us coming on a beautiful sunny day, but it can be nighttime, it can be foggy, it can be in the middle of winter, it can be a blizzard. And for us to be able to see on both sides, you know, not have to look backwards as we go by to see if the mailbox said, you know, that it was their house, or that it's on something where we can see that it's your house. That can be very helpful. It can be frustrating and time consuming for us to have to slowly creep along to figure out which house we're responding to. So I think that's one of the things that I would say it helps our department.
Thank you, Brian, very much. Gina is our new veterans agent, so she's going to tell us a little bit about the services she can provide us.
Carlisle Veteran Services is now a part of the Lexington Bedford Veteran Services District. So my name is Gina Rada. I'm the district director for Lexington, Bedford, and Carlisle now, Veteran Services. I also have a part-time veteran service officer, Bill Lenahan. He primarily works for Bedford, but he would step in for me if I was out for a conference or for any other reason. It's available to help. So I have our contact information here. My primary office is in Lexington at the Lexington Community Center. I have my office number here, but for right now, the best way to get in touch with me would be through my cell phone. I am working primarily remotely right now, and that cell is 781-953-3160. So I am still working Monday through Friday, 8:30 to 4:30 every day. So you can give a call if you have any questions, or you can send me an email, and my email address is grada@lexingtonma.gov. I also have Bill's information in here as well, just in case someone can't, for whatever reason, get in touch with me. They are more than welcome to call him, and he's happy to help as well. So this is just some of the stuff that we do help with in our office. There are a number of state benefits and federal benefits available to veterans and their dependents. And we're going to go over some of this, not all of it, just because we could be here for quite a while talking about all the great stuff that's available to our veterans, but I'll just go over some of the more commonly requested benefits and services. So all of the benefits, whether they're state or federal, do have some eligibility requirements. And most benefits are based upon a discharge from active military service that is under other than dishonorable conditions. And then Massachusetts has their own definition of what a veteran is, and that is that the veteran has to have served at least 90 days of active duty service during a wartime, or 180 days of active duty service during a peacetime, and that has to be for purposes other than training. Our major responsibility in the Veterans Office is to distribute Chapter 115 financial assistance to lower income veterans and their dependents. So under Chapter 115 of Massachusetts General Laws, the Commonwealth provides a uniform program of financial and medical assistance for eligible veterans and their dependents, and qualifying veterans and their dependents would receive financial assistance that can go towards things like food, rent, or their mortgage, clothing, housing, supplies, and medical care. It's not a flat rate benefit, so it really does depend on what the maximum monthly income for that household is, and there is a max income and max asset limit. So for one veteran, a single veteran, or a single surviving spouse, they would have to be bringing in less than $2,126 a month in income and have less than $5,000 saved up in the bank. So the closer you get to $2,126, the smaller the benefit amount is going to be. But a good piece of this benefit is that we do medical reimbursement. So if we have somebody who maybe is up at the higher end of that max monthly income, but they're paying for Medicare Part B or some kind of supplemental insurance, or have sort of a lot of expenses and prescriptions and copays, all of those things are reimbursed under the program. So that can help out a little bit with some of those costs that can take up quite a bit of your monthly income once you start paying out. These benefits are federal benefits. So disability compensation is a benefit paid to veterans because of injuries or disease that happen during active duty. In some cases, an existing disease or injury was worsened due to active military service. So this is the benefit that you hear when people are saying that they are disabled veterans. I'm not a VA employee, but I do serve as a liaison between the veteran and the VA. So some of these application process can seem a bit daunting when you look at the applications, or you're not really sure where to begin, and a veteran service officer can help you fill out the application and get all of the supporting documentation you need in order to submit it, and then we can submit it to the VA on your behalf. A common compensation disability claim can be something like hearing loss. If you were in a job when you were in the military that you found yourself exposed to extremely loud noises on a regular basis, you might notice that you suffered some hearing loss or perhaps ringing in the ears. Those are things that you can request a disability claim for through the VA. The VA pension is a bit different. That's a needs-based benefit program for wartime veterans who are age 65 or older, or have a permanent and total non-service connected disability, and who have limited income and net worth. So this is in place to provide some financial assistance to those who have a limited income, as opposed to the disability compensation, which income does not come into play with. There are a number of surviving spouse benefits as well. Dependency and indemnity compensation is a monthly benefit paid to spouses who the veteran's death occurred in service, or the veteran passes away from a service-connected disability, or in certain circumstances, if the veteran was rated totally disabled from service-connected disabilities dies from non-service connected conditions. So if you're not sure, some of these benefits have lots of different little eligibility criteria. And so if you're not quite sure, then I would just suggest giving me a call, and we can go over everything and see if that's something that you may be eligible for. The survivor's pension, similarly to the veteran's pension, is a tax-free benefit payable to a low-income, unremarried surviving spouse or unmarried children of a deceased veteran with wartime service. Aid and attendance is an enhanced or special monthly pension. It's piggybacks off of that veteran's pension or that surviving spouse pension that I just spoke about. It's a higher monthly pension amount that is paid to the veteran or the spouse. So if you find yourself, if this is the situation that you might be in, that all of a sudden now you might require the aid of another person in order to perform some activities of daily living. Perhaps you are homebound. If you're in a nursing home, you may be eligible for this additional monthly entitlement, which can help offset some of the costs that are associated with home health aides, nursing home costs, assisted living. VA healthcare. So we, as our office, can help you at least apply for VA healthcare if you're not already enrolled and you're thinking that you want to at least see what you might be eligible for in terms of using the VA healthcare system. I can help you fill out the application, which is a 1010 easy. It can also be submitted online, but sometimes you might like to just sit down, go over the application with somebody. We can do that. I can submit it electronically for you. And then most veterans in this particular area would use the Bedford VA healthcare system, which is the Edith Nourse Rogers Memorial Veterans Hospital, which is located in Bedford. I do have their phone number here, which is 781-687-2000, and you can certainly call, and if you have questions and you want to speak to the healthcare system directly, you can do that, or you could just call me and I can hopefully answer any questions you might have prior to filling out the application or after if you have questions about any coverage that you might have. The VA, talking about burial and memorial benefits. So these are other benefits that are available through the VA that I, as your veteran service officer, can help you apply for. As a veteran, veterans are eligible to be buried in VA national cemeteries. There are headstones, markers, and medallions available from the VA, delivered at no cost anywhere in the world. And then as your VA or your veteran service officer, I can help you fill out those applications and also work with the cemetery that the veteran is going to be buried at, and we can work to get either a headstone or a marker installed at those cemeteries. Some veterans might be entitled to an allowance towards burial, plot, and transportation. So my suggestion here would be that if a veteran passes away and perhaps a surviving spouse or family members have questions as to what their veteran may be entitled to just call the Veteran Service Office and talk to myself or Bill, and we can hopefully answer any questions about additional funding that we can get towards the services. In certain circumstances, the VA will pay up to $2,000 if the veteran's death is service connected, and then there are other allowances as well. If the veteran isn't necessarily service connected, there are still benefits that we can access for the family. And then military funeral honors. So upon request, the DOD will provide, that's Department of Defense, will provide military funeral honors consisting of folding and presentation of the United States flag and the playing of taps. So our office can help with that, as well as funeral homes that you decide to go through can also help coordinate those funeral honors. This is property tax exemptions. This is different for every city and town. So I just want to be specified that these numbers are specific to Carlisle. So if you are a veteran and you have a service-connected disability, anywhere from 10% to 90%, you can receive a $750 tax exemption. If you're 100% service-connected, then you'd receive a $1,000 tax exemption. And I can certainly help the veteran and family with the application, but those are, you would contact the assessor's office to get those applications, and then you'd need to submit some supporting documentation, which I can also help the family in accessing. Something that we do commonly, you're always going to need, as a veteran, you're always going to need your military discharge documents. That's what we refer to as a DD form 214. So sometimes veterans might have misplaced them, or the copy that they have is not in the best of conditions. We can help the family get new records. So whether that might be going through National Archives, which keeps all of the discharge papers, or accessing records through our database, which covers veterans who were Massachusetts residents at the time that they went into the service. We have access to most of those records. So we can do those requests, and going through National Archives, I've seen it can take, you know, somewhere between 3 weeks, 4 weeks, ideally. Right now it's a little bit slower because of what's going on, but we can put in the request for that family and get some replacement records. That also goes for medical records and military awards and decorations. So a veteran might want a copy of their military medical records as they start compiling an application for disability compensation. We can help get those military medical records for the veteran. And then a lot of families like to have the veterans awards, medals, and decorations to have for the family, and we can always request replacement medals and awards and decorations for that family if they need replacements. So that's my last slide. I can answer questions, and that's sort of like a very brief overview of our common benefits that people are coming to ask about. But I suggest if anything like that sounds like it might pertain to you, to call me again on my cell phone, and we can discuss, and hopefully in the near future set up an appointment to meet and go over those things.
Gina, are there particular times you're available?
So I am available, and I'm just trying to get maybe back onto the screen if we could. If Chuck wants to get out of the. Let's see. Sorry. Stop share. There we go. Okay. Okay, so I'm available Monday through Friday from 8:30 to 4:30. I bounce around in the different offices. Right now I'm working from home, but there are days I'm in Lexington, some days I'm in Bedford, and then when we sort of go back to normal, or at least our new normal, I will be setting up Carlisle office hours. But I'm always available by phone Monday through Friday, 8:30 to 4:30. And if someone in Carlisle wants to come, if they don't mind coming to Bedford or Lexington, then they can come see me. You know, if they don't want to wait until Carlisle office hours are set up and they need something and maybe it's more urgent, they can come to whatever office I might be in that day. So I am available to Carlisle veterans and families full time.
Thank you. In terms of the benefits for the property tax, I believe those applications need to be done between January and March 31st. Is that correct?
So the deadline for submitting those applications would have to be something that we'd have to run by the assessor's office. I do know that it is in the earlier part of the year. I know this year some of the offices have granted an extension, so I'm not sure if that's the same in Carlisle, but I think it is worth asking. If you watch the slideshow presentation, you realize perhaps you weren't getting the property tax exemption, then my suggestion would be to first contact the assessor's office and find out about the deadlines for submitting those applications. And then if they need the supporting documentation, which is often the VA disability verification letter that says that veteran does in fact have a rating from the VA, and they don't have that letter, I can get that for them.
Do you have any ability to help people get into the long-term care that the VA provides for certain veterans?
So in terms of that, I can really only take the veterans so far. So what I would do is, if they weren't already enrolled in the VA healthcare system, then I would certainly get them enrolled. And then the process sort of goes from there to having a meeting with your primary care physician, finding out if you meet the criteria medically. And then I do think that the healthcare systems have some additional criteria in place. They obviously are going to fill their spots. The first come would be that would go to like 100% service connected, totally disabled veteran would get the priority, and then they go from there. So there are some differences when you're talking about long-term care, and it's a conversation that you'd have to have with your primary care physician. But in terms of the application process, I can get you that far.
Terrific, thank you.
Thank
Anybody
you.
else have any questions for Gina? Okay, then Joan, do you want to tell us a little bit about transportation?
Sure, I'd be delighted to. So we are continuing with our transportation services right now for medical appointments. So if you'd like to schedule transportation to a medical appointment, you can call our transportation line, 978-371-6690. Also, the neighbor response team, Carlisle neighbor response team, continues to have volunteers that are doing grocery shopping, delivering medications, and other necessities to seniors and people in need. And if you don't have anyone else to help you with these services, you could call the neighbor response team directly, and their number is 978-254-0508. So those are two things that are important to know. And also, we have face masks, we have a supply of homemade masks, and we have other masks that are available to anybody who needs one. So if you would like a face mask, you don't have one, or the one that you have, is creating some kind of issue for you, just call the COA and we will make sure that you get a face mask delivered to your home. So that is what I wanted to summarize about transportation.
Okay, and then I'll quickly give a little bit of information about some of the things we're doing in July and August. We're trying desperately to get some actual in-person events, and we're doing, excuse me, 2 drive-in musicals. One will be a combination of trios and solos and maybe a duo with 3 people from the BSO, Rebecca Gitter, who's a violist in Carlisle, and Lucia Lynn, and cellist Mickey Katz. So they'll be doing this on July 8th at 10 a.m. at the Congregational Church. And if it's really hot or it rains, we will move to July 13th. We also have a jazz group joining us with his Jill Jokum and John Lyons and Harvey Nazowitz. And they will be also playing at the Congregational Church parking lot on August 10th at 10 o'clock with a hot or rain date of August 12th. And because we can't do our usual breakfast and coffees, we're going to do a drive-through coffee and pastry on August 20th. So people do need to call the COA and tell us what kind of pastry they want. And then we'll have them come by their last name, so we don't have everybody waiting in line to get what they're looking for. And all that information is going to be in our newsletter. And also in August, we're going to do a tour of Clark Farm outside to see what's growing and their livestock. And that's going to be on August 5th at 10 a.m. And Peter Alden, who is very well known for his work in National Audubon, and he's written one of their field guides, and he will be doing a talk for us on changes in our birds and mammals life in Carlisle on August 20th. We hope that's going to be the day. We're waiting to see what we can do, whether it will be in person or over Zoom or what, but we are asking people to sign up so that we are hopeful if we can do it in person. We're going to try to make sure that the people that can't see it online will be able to come.
So we're scheduling a meet and greet with me, the new COA director, to meet anybody who's interested on Wednesday, July 29th at 10 a.m. So it's going to be a Zoom. We can send the link to anybody who would like to join, and in our newsletter, we'll ask you to call the COA by a few days prior so that we know who's coming. but it's really a chance for me to, you know, speak with people, have a face-to-face conversation, and hear what people, you know, enjoy the most, what you'd like to see, and, you know, how we can be more responsive, if we can be, to whatever it is that you're thinking and feeling and looking for from the COA. So I hope people will want to take that time, and I really look forward to talking to some more seniors.
Terrific. Thank you. We're also doing a number of things virtually. So we do send out that information in our newsletter that we do electronically, and it's on the town website under the COA webpage. And we are doing a community book group via Zoom on the July 6th and August 3rd. We're doing reading with poetry on July 7th and August 4th. We're doing senior moments, which Chuck also hosts on July 6th, 20th, 3rd, 17th, and 31st of August. And we're doing a digital conversation and coffee with Shishi Van Ingwen. And Shishi's new to our COA as a volunteer. And she's been hosting a coffee and conversation, and she'll be doing it on July 9th, the 23rd, and August 6th. And we're also going to be continuing our French conversation group, which we're doing via Zoom. And that is every Friday at 3. So if you speak French, even a little or a lot, and you'd like to join, we can get you that information. And we are doing both of our knitting groups online. So if you knit and you want to join in and knit with our knitters, we have 2 groups. One sort of knits for whatever they'd like to do, and they're normally at the Gleason Public Library. So they're meeting at July 6th, the 20th, August 3rd, and 17th. And the meeting and service group, which knits for the homeless at the Common Cathedral, we do hats and scarves, and we meet on Thursday evenings at 7:30, July 16th and August 20th, and we make the hats and scarves all year, and in early November, we give them to Common Cathedral, and they give them out to the homeless people in Boston. We're also doing a special memoir project. So if you are a Carlisle resident and a senior, and you would like to take some of the time that you're isolated and talk about yourself and what it's been like in your life, or a particular time where you grew up, anything that really you felt you'd like to pass on to your family, would like you to have the opportunity to spend time talking with friends and neighbors and family to see what would be important to share. We're hoping this will bring you closer to a lot of people, and also allow people to learn a little bit about you and give you something to pass on. And you can get to me through my email, which is asmith@carlislema.gov, and submit a request to be included in this. And then lastly, before we go back to Joan, the library is starting to do curbside pickup. So you can order through the library, and our neighbor response team will even deliver it if you can't pick it up yourself. So, Joan, do you want to tell us a little bit about our exercise classes?
Would love to. So we have some online exercise classes that you can view at any time through YouTube. And to get links to those, you just have to go to the COA website. Some of the classes that we have include tap dancing, Zumba Gold, Tai Chi, chair yoga, line dancing, fitness, and cardio boost. So we encourage people to, try to participate in those if you can. We also have senior approach to maintaining agility, and that's through Zoom. So if you want to do that, you can email, it's going to be in our newsletter, but you can email Sarah at osbkarate@live.com, and you can get the link and register for that class. We also have distant Reiki healing. And that you can call the COA, you can call Linda at the COA or email her, and then you can get in touch with the person who's running that, and you can get the information and the link that you need to do that. We're working on, ways to get people back into podiatry. So Dr. Gregorian will see seniors at her office in July and August, and you can schedule an appointment in Bedford or Sudbury by calling 978-501-7176. But you'll need to pay for that, and maybe you're covered partially or completely by your insurance, and let her know that you're from, you're affiliated with the Carlisle COA. But we're planning to start our clinic again at her office in September, and the information will be in the newsletter. But we're going to have 3 dates in September where people can schedule appointments and then pay the reduced fee, even though it's going to cost a little more because of the extra time involved in terms of the protocols and the safety involved. The fee is $40, but seniors will continue to pay $25 because the Friends of the Carlisle Council on Aging have generously agreed to increase their subsidy to $15. And if you need a ride, let us know when you schedule your appointment and we could arrange the ride. And you are expected to wear a mask unless you have a medical condition that prevents you from wearing one. And then the last thing I wanted to mention is our Haircuts on the Go was a huge success. We had 36 people. Thanks again to Chief Soros for allowing us to use the fire station. It worked really well. People were really excited and thrilled. So back by popular demand, we have another date, which is July 27th. By appointment, the same stylists and the same safety precautions. So you can just call the COA to schedule your appointment and to get more details.
Thank you, Joan.
You're welcome.
So
we're
maybe
gonna
we can
change all
go
the-
to
Just gonna say
Elizabeth.
sides on the trucks to say Carlisle Fire Department and Hair Salon.
That would be good. Elizabeth, can you unmute yourself and tell us a little bit about the Friends of the Council on Aging?
Okay, well, I'm Elizabeth Aquaviva. I have been on the Friends of the Carlisle Council on Aging for the past few years. And so unfortunately, due to COVID, we had to cancel our annual town-wide meeting and guest speaker, which was scheduled for June. The Friends have been having monthly Zoom meetings, and our annual appeal for donations is typically at the end of November. However, we're thrilled that our caring and generous community has been donating during the pandemic to help our senior citizens receive the support they need during these unusual times. And keep donating. We welcome any donation at any time of the year. The Friends of the COA have funded 2 Art Matters programs that are widely attended, and we had to cancel the April lectures. So Jane Blair, her company has decided to do an online viewing. So there will be 2, an Art Matters 1, which covers American art from 1776 to the 1900s, and American Art Part 2 from 1900 to 1950. To sign up for these, you don't need any special software, but you do need to have a login. And the full description of these will be in the Council on Aging newsletter, as well as their website and the Gleason Library website. You would contact Martha Patton of the Gleason Library to get that login information. So,
Elizabeth, do you want to say anything else about all the things that the Friends support in terms of, besides the subsidy for the podiatry clinic? Do you want to?
Well, the Friends support many of the programs that the COA offers. They provide fuel assistance. They do supply, some of the guest speakers and coffees, monthly coffees.
And you're also very generous in terms of helping us with some of our transportation and also subsidy for our exercise classes. So we really
Right.
would like to thank the Friends for all that you do. And we keep finding new ways to enjoy the benefits of your fundraising for us. So thank you very much.
Oh, thank you for all you do.
So Joan, do you want to talk about the benefits of possibly taking advantage of Habitat for Humanity?
Sure. Okay. So the Habitat for Humanity of Greater Lowell provides home repairs. In addition, most people think of Habitat as building new homes, which they do, but they also have a critical home repair program for qualifying seniors, veterans, and families designed to help homeowners remain in their homes by providing affordable critical repairs. So there's an income eligibility, and this is all going to be in our newsletter. But basically for one person, if your maximum annual income is $49,980 or below, you would qualify for this benefit. And you could contact the Habitat for Humanity Outreach Director, Lisa Garvey, at 978-692-0927, or you can email her at lgarvey, G-A-R-V-E-Y, at lowellhabitat.org. So if you're a family of two, the income limit is $57,000 and it goes up from there. They also have a restore, and the restore is open and they're looking for volunteers, shoppers, and donations. And then, you know, you can visit their website, Lowell Habitat Restore, to look for what hours they're open, what the volunteer opportunities are, items that they will accept for the store, and how you can schedule a free pickup. So that information is all available on their website, or you could call 978-215-9975. But if you visit the website, you get a 20% off coupon. So that's all the Habitat for Humanity of Greater Lowell. So, you know, and the information will all be in print in our upcoming summer newsletter.
Terrific. Thank you so much. Well, the COA wouldn't be anything without our volunteers, and we have some of them, including Chuck and Elizabeth, on today, but we also have probably close to 100 other volunteers, and some of those volunteers provide services that we hope all of you will take advantage of. One is our Shine Counselor, Clyde Kessel, and Clyde provides medical information. So if you're 65 and you want to look at your options, or you're already on Medicare, but maybe there's a better plan for you and you'd like to know if you can reduce your prescription costs, then you can call the COA at 978-371-2895, and we'll get you connected with Clyde, and he can virtually go through your insurance needs and try to find the best choices for you. And Chuck not only does technology with us and helps at the men's breakfast whenever we get back to doing things in person, but he also helps Clyde with medical equipment delivery, and that's available for people in Carlisle no matter what age you are. So if you ended up having a fall or needing surgery and you need medical equipment, you just have to call us, and either somebody from your family can meet us, and Chuck or Clyde will deliver it to you either way. And we have several people who do computer support. Bob Supnick is probably our prime person. And Bob goes around and collects computers that people aren't using. He upgrades them, he fixes them, whether it's a printer or a computer or a desktop. He is there for us, and if you're having a problem, you can give us a call. We'll put you in contact with him, and he will talk to you on the phone and try to figure out what's going wrong. And if necessary, he will give you or loan you another computer to help you out in the meantime. For all of us that are technically challenged, we also have somebody who does cell phone support. So if you're wanting to move to a cell phone, or you have a smartphone but you don't know how to use it, and you'd like to do FaceTime with your grandkids, or you want to know how to get your cell phone bill to be less, Gabby Steinberg is just a master at figuring out all the different cell phone plans and what your needs are and how to make it the most cost effective for you. And Chuck has been helping people out with Zoom, and we've had a lot of people getting computers from Bob, and then Chuck's helped them get onto Zoom so they can participate in some of the programs that are going on, not just ours, but those that are available that we list in our online emails that tell you you can take a tour, you can take a cooking class, you can do all sorts of games and enjoy so many things right in your own home with your computer and a webcam or a laptop. And then one of the other things I wanted to talk about was the fact that one of our volunteers, who is also a staff member, is going to take pictures this summer. So Miriam Florimond, if you are a senior and your family would love a new picture of you, or you would love a picture of one of your friends and you, then all you have to do is call us at the COA and ask that Miriam go out and in your yard, socially distanced, we'll take your picture and she will get 2 copies made so you can have one and give one away. So we're hoping people take advantage of this, either for no reason at all, that they just want to have a new picture, or because it's a birthday or there's some sort of celebration. So maybe it's your anniversary and you'd like to have a remembrance. So because we can't do Old Home Day in our normal crafts, then that's what we're going to be trying to do to get a little bit of sunshine to you. We would like to thank all of our volunteers who make a huge difference to everything that we do. We have so many people that are pitching in with Meals on Wheels, with providing technology, with helping at programs, with delivering food, with delivering groceries. The list goes on. And we never know what skill and talent we could use. So if you have a skill or talent and you want to help, then please call the COA and we'll get you signed up as a volunteer and figure out how to take advantage of your skills and have you help our seniors. So Chuck, anything you'd like to add before we sign off?
No, I think you covered it very nicely, Angela and Elizabeth and Joan. Thank you. And we're good here. And if, as I said, as you said, if people do need help with Zoom, they can email or call me, and I can set up a private Zoom meeting and get them started so they are more familiar and comfortable with it. We had our own Zoom problems this morning.
We sure did.
So we'll go back and check that and maybe do a few edits.
And Brian, we want to thank you for being our new home, helping us with so many ways, and especially with haircuts. And I know you're open to some of our upcoming programs and billing us out, because most of our usual locations, the church halls, are closed at this point, and opening the bay allows fresh air and makes things safer. And you've been so generous, as well as your whole staff, to allow us to invade the fire station. So thank you very, very much.
Yep, we
Anything
want
else?
everybody to stay safe, so this is great. It's great to be able, and people have needs, so it's great to be able to use the town resources to help people out.
We'd also like to thank Brian, because he's been collecting the masks for us. So all the wonderful sewers in town that have been making masks have been dropping them off at the fire station, and I'll come into my office and find a bag of beautiful masks. So thank you for that. And they've made a difference. When we had the haircuts, I think we gave out over 30 of them. And I know that Lori Eckler and the Carlisle response team have delivered probably close to 150 already. So if you need one, as Joan said, please just give us a call and we'll get it to you We don't want anybody to not have a mask. And we know there's some seniors out there that haven't gone out yet. So when you are going to start venturing out, please feel comfortable with calling us for a mask or two so that you're as safe as we can get you to be. So with no further ado, I think we're going to sign off.